Hi everybody, welcome back to my channel. In today's video we're going to talk about opioid addiction. If this is your first time here, please subscribe and hit that notification bell. So a question for you, do you know the signs and symptoms of someone who has an opioid addiction? If you'd like to know more, stay with me for a few minutes. I'm the Comfortable Counselor. Put your feet up, relax, let's do this. So why have I brought this up in the first place? Men are, as you know, I'm very passionate about helping men. Men are actually twice as likely to die from an opioid overdose than women. And there are various reasons for that we can probably get into later. But right now, I just want to do an overview on this and keep it really simple. So what are some examples of opioids? Well, we have opium, codeine, fentanyl, heroin, hydrocodone, morphine, oxycodone, and tramadol. Those are just common drugs or drug names of opioids that you may get from various places, including the hospitals. So how do you get these kinds of opioids? Well, they're pain pills for the most part. And you know what's kind of sad and interesting at the same time is that you can go to the doctor for something really simple, a procedure. Maybe you've had a toothache or tooth surgery or some kind of other surgery. You go home, it's probably even outpatient. They write you a script, here, take these, you'll feel better. Well, great, okay, so you feel better, but then guess what, right? Like, oh my golly, this is the best thing I've had since never. And so you're like, whoa, I like these. And that's where things kind of start. So how does the addiction start in the first place when it comes to opioids? Opioids trigger release of endorphins, which are your feel-good transmitters. Endorphins muffle the signs and symptoms of having pain, which is what you want in the first place. You like the pain pills. They take away the pain, but they also have a little boost of extra, like, whoa, that feels really good. So you take one, like, okay, well, if one is good, then let's try two, right? And so from 2 goes to 3, goes to 4, and then pretty soon your body is building up a tolerance, which basically means you need more and more and more to get the same level of that, bam, feel-good chemicals shooting off in your brain. So tolerance can be a very dangerous, I guess, symptom, or a very obvious symptom of being addicted to opioids. Pain pills are expensive. Usually what happens is, and they're harder to get, what happens is people will go from pain pills to heroin. And that's where things get really dangerous. Because then you're getting into a whole different world and culture and danger. I'm talking about needle use and sharing needles and all sorts of other diseases that you pick up with that. And that's where your life starts taking a really dark turn. So what do symptoms look like when someone is highly dependent or addicted to opioids? First of all, their quality of life is going to go downhill. They're going to start dressing differently. They're going to start making up little white lies, excuses, like their money is going to go like, bam, gone. If they have a job, any savings they may have had, it's going to be pretty much drained immediately because, well, it's an expensive habit. Other symptoms that you may want to look for, I guess, that are more obvious, I guess, when a person has ingested an opioid: shallow or slow breathing, drowsiness, poor decision making, mood swings, euphoria, depression. Because I may have not mentioned this before, I don't think I did, but that category of opioids, they are depressants. What does that mean? Basically, it tells the brain to start slowing things down, which is why you start mixing pain pills and like a Xanax or pain pills and alcohol. Those are all depressants, and they just tell the body to just shut down slowly. Your organs start shutting down, breathing, heart, everything starts shutting down to the point where you fall asleep and don't wake up. And so that's basically kind of how that works in regards to symptoms and, I guess, the negative effects of how the opiates affect the body. But anyway, like I was saying, lowered motivation. You're going to see a change, very, very slight. You have more excuses, less money, and a definitely change in personality. It'll be slight perhaps, but you're going to see something And chances are your gut is going to be right on most of the time, I would say. So a few other symptoms you may want to look at and be observant about in regards to someone who might have an opiate addiction. I mentioned the dress, or how their dress style will change. In other words, they don't care about really anything about how they look. Hygiene will be an issue. Brushing their teeth, their skin may look different. They will look depressed, and they will be going through. You won't be able to put your finger on it, but there'll definitely be a change in their personality. Constipation is a big one. Opiates will really back you up, back up your plumbing, I guess, so to speak. And so if you have someone in your life you're close to, and you observe these things, you may want to confront them about this. Okay, do your research first, more than anything, before you confront them. But like I said before, though, your gut feeling may be telling you something. So trust that instinct. Withdrawal symptoms, you will really know if someone is addicted to an opiate or highly dependent on opiate when the withdrawal symptoms come. And things like that are very obvious, like nausea, muscle cramping. I've heard that people have said to me, my bones feel like they are grinding against each other. There'll be agitation, irritability, cravings, again, depression from not being able to get their next fix, their next dose of an opiate. So be observant. Those are really obvious signs. More than just the regular signs, the withdrawal symptoms are so obvious, which is why people, it's like going through hell. It's like the worst withdrawal symptoms of any of the other kinds of drugs. Now, let me just say for a second, there's a sidebar. Alcohol and benzos, you can die, okay, from withdrawing from those too quickly, too fast, cold turkey. So that's a sidebar. But you will wish you were dead, pretty much, by withdrawing from opiates. Take my word for it. Now, how to treat an opioid addiction. I've worked in a methadone clinic for a number of years, and this is my thought process. I've heard people say a lot of crap about methadone and Suboxone and those kinds of synthetic opiates that help people get off of opiates. And one of the things they want to say is, well, that doesn't work. My friends and family, they've been on this for 5, 10, 15, 20 years. All it does is become addicted to something else. And so methadone gets a bad rap. My philosophy on this is methadone is a great program. Suboxone is a great program. If you treat it like a tool, it's like therapy. If you're crutching on your therapist for all your inspiration, all your motivation, all your answers, then you're dependent and you're not really growing. You have to do the work yourself. I see clients once a week, once every 2 weeks for like 50 plus minutes. I can't expect to have that large of an impact on somebody if they're not doing the work themselves. Methadone's the same way. Those doses of methadone are only a tool to help you get your job back, to find a job, to function, to be able to live, not to be so freaking miserable because, again, you're in that cycle of the addiction of trying to find the drug, taking the drug, hiding, while taking the drug, etc., etc. You're off of that cycle and into the real world again. But the problem is, what I found is that people would stay on methadone for 5, 10, 15, 20 years. So you get off the drug cycle and back into the real world, and you're thinking, wow, I feel great. The problem is that people will stay on methadone for 5, 10, 15, 20 years because they use it as a crutch and not a tool. Methadone clinics, for the most part, they're in it for business. They will take your money for as long as you want to give them money for the methadone, okay, or Suboxone or whatever. They're in the business to make money. So as long as you pay, they'll give it to you. But if you will just do the work behind the scenes, attend groups, attend Narcotics Anonymous groups, therapy, hobbies, whatever it's going to take to get yourself off of methadone. I'll be honest with you, methadone, the whole program should be no more than like a year and a half, 2 years max, where you kind of give it up to a level of milligrams, right? You stabilize for a while, and then you slowly come back down so that you're totally weaned off of opiates by way of help of methadone. It's a great program, but people will not do the work behind the scenes, which is a lot of self-work, and it's uncomfortable, and it's painful. There's a reason. You have to remember there's a reason why we get addicted to anything. It's usually because we're trying to escape something, feel better. But why do we feel better? Feel better than what? Why aren't we feeling the proverbial normal, whatever that is? It's different for every person. Do the work. You can do it. And I would beg you, please, get help. If this is resonating with you, please get help. If you know somebody who's suffering, encourage them. Have that conversation. Even if they get mad at you, be bold, be brave, be direct. You may be the only person who really can help them. As always, I hope you have gotten something positive from this video. If nothing else, please remember, this is your life. This is your story. You have the power. You have the ability to write or rewrite your story as many times as you want. Check out my videos every Sunday. Please subscribe and hit that notification bell. This is The Comfortable Counselor. My name is Patrick. Have a great week.